Hi, it's Adrian from Advanced Dental Artistry here in West Perth. A lot of times when patients lose teeth, it's not a fault of their own. There's a huge genetic component when patients lose teeth, and as patients lose teeth, they also find that their bite and their cosmetics, of course, changes. This is Kelly. She's in her late 40s and she's actually come to see us for a cosmetic reason. You can see when we're actually looking at her smile, you can see a lot of her lower teeth, and they're very misaligned. They're very high at the front and very low at the back, and this is because she has lost some front teeth. When patients lose teeth, of course, they normally use a denture to replace the teeth, and in Kelly's case, you can see here she's been wearing a denture. It's been very loose, so there's a lot of adhesive just to hold that denture in place. So there's a bite compromise as well as an aesthetic compromise in this case. Of course, when patients get this treatment, they go to sleep, so that's Dr. Adrian, actually the anaesthetist, putting Kelly to sleep. This is the next day, so we're just doing what we call a trial and a verification of everything to make sure the bite and the cosmetics are actually correct. The next day is, of course, the final, when we actually put the final bridge in. So that's a photo of the upper and a photo of the lower bridge. And you can see the change in the profile here once the upper teeth actually go in. Again, some photos are taken. Notice the bruising on the lower right hand side. This sometimes happens during surgery, but it fades fairly quickly. Just taking some more portraits of the patients. And you can see here again the bruise on the lower right hand side. This is the 1 week check. It's very important to check how everything's going after a week. Here's the healing. You can see the gums have actually healed really well. Some sutures in place, but they will dissolve and fall out by themselves. Some more, you can see the bruises almost faded completely even after a week. Always go to 2 week check. So at this stage, you're really checking the oral hygiene. Patients have healed, as in their gums have healed completely, just waiting for the implants to take, which normally takes around about 3 months. Again, the profile shot. And we can see here the 4 week check, so really coming to the end of the treatment here. We're just really making sure that she's going really well in the healing phase. And here's some final photos here of Kelly. And the before and after video, of course. Thanks for watching, and call 1-800-SMILING.